Now let's discuss the mental health in this time of the pandemic, how people have been coping and what to do. And I have joining me now to discuss this further, Kunle Pelemo. Thank you very much for joining me right now on TVC News. So make us understand the correlation between mental health and COVID-19 and, of course, the impact on one's well-being.
Okay, thank you. It's good to be on the news. There are consequences associated with fighting the COVID-19. You know, the virus comes with its health challenge itself on its own, and fighting it is also having a ripple effect on the entire mental health of a whole lot of people. The reason is because anything that affects, the state of our mental health, the three important states of our mental health are emotional state, our psychological state, and our social state. Now remember, the new normal right now, or because of this pandemic, is we have to physical distance or social distance. So people are finding it difficult to adjust to all these things, and it's creating a whole lot of stress on them. And then the other effect of fear that we have, if you look at it, there is a prediction that there will be younger pandemic even after this COVID-19 pandemic, and we have also rape cases, rape pandemic, racism pandemic, and a whole lot of things coupled together. All these are bringing a kind of fear in people, leading to anxiety, leading to panic attacks. You know, people are losing their jobs. That is also creating socio-economic distress on people, which is also affecting part of their psychology, which is a part of what I mentioned earlier on, the state of their mental health. So all these contributing factors are very, very, notable when it comes to what is happening in this pandemic era.
So how can this be managed in this critical period where we know we have a pandemic, a global health crisis, which stares us in the face? How can we handle some of these mental health challenges you've mentioned so far?
This is what I would tell everybody who is listening, and three critical things. Number one is gratitude. I call it GMC, gratitude. You know, I will use the word of Tony Robbins right here. We need to trade our expectation for appreciation right now. There are a whole lot of things that we cannot control. We should not be mindful of those things. And that will take me to the second thing, which is mindfulness. Mindfulness is the act of staying in the present. So we have to just be present right now. Let's see what we are doing right now and how we can handle what we are doing right now, and not be bothered by things that does not even concern us. You hear news of people who are dying, people who are losing their jobs, people, who are taking pay cuts to retain their work job or so. But if that doesn't concern you, you have to just be mindful of the present. And even if you are affected in any way, be mindful of the present. And the last but not the least is what I call conscious breathing. Conscious breathing. This is different from the unconscious breathing that we all, that is one of our characteristics as a human being. But conscious breathing, there is a huge or intimate relationship between our breath and our mind and our body. So if you breathe, there are ways where you can control your breath to relieve yourself of stress during this period. So I'm saying it to everybody right now, including you in the studio, that you could also remember to breathe.
Indeed, that is something that I would take home when I get, on my own spare time. But, aside from what you've mentioned so far, what about exercises? I understand exercises has a role to play. What other things can one apply, in terms of dealing with this pandemic so that one doesn't break down into depression or any of this mental health challenges?
You've mentioned a very perfect example of one of those things that can be done, and that is taking care of your physical health, which is exercise. There are hormones that are secreted in your body when you exercise to a particular level for maybe for a particular time as well, maybe for about 15 minutes. So your body will try as much as possible to want to relieve you of the pain. So that hormone will be secreted in your body when you exercise. And that hormone, they are stress relieving hormones. So exercise is one of those things. And as well as our diet, we should be mindful of what we eat. you are not only a product of, let me just put it straight, that you're a product of what you eat. So our diets are very, very, very important. Eat vegetables, some cereals and legumes, and eat less of sugar that will make you obese, So that will go a long way in helping us mentally.
An insightful conversation with you, Kunle Pelemo. We appreciate your insights on TVC News at this time.